for clarity and also to add to my colleague what my colleague has said, I think it is important for us to recognize the global nature of transport and the global nature of this menace. The lady in question, for instance, traveled from Ohio, traveled to Chicago, traveled through London, and ended up in Nairobi. So you can see all the areas that she passed through. Now, let me also add this, that in each of those areas, all the measures that we have been talking about, temperatures, thermal scanners, they are there. But the nature of, and in Nairobi, she was definitely checked. In London, she was checked. In Chicago, she was checked. But there is the period, the 14-day period, because she came on the 5th, and all that time, she was completely and totally normal. So I think we need to be sensitive and understand the complexity of this situation.
Any other? Yes?
As I said, the decision was to ban all public rallies. There is no exception. Let me let me say this. First and foremost, I actually want to thank this lady. I want to thank her so much, because the minute she started feeling slightly unwell, and she said to us, having read what we have been publishing, she felt that she should go to a hospital. She took herself to the hospital. She's a very responsible citizen. She has given us the names of each and every person she has been in contact with throughout that period. We are also informing through this committee and through our Foreign Affairs Ministry. We have informed the British High Commission. We are in the process of informing the American ambassador, because these are people who came from those countries. And this is an import. This is an import case. It is not a homegrown case, which then tells us that hopefully, keeping our fingers crossed, it might be an isolated one and we can tackle it.
Swali langu ni kuuliza kama serikali itaingilia kudhibiti bei ya bidhaa, manake baadhi ya bidhaa muhimu ambazo Wakenya wametumia kujikinga na ugonjwa tayari zimeanza kupanda bei. Sisi kama serikali itaingilia kudhibiti bei ya hizo bidhaa.
We have explained, and I have just made an appeal to the business community, because I said this is immoral, really, in this situation, for people to increase their prices, not because of the cost of production, but to make abnormal profits. And we can only appeal. At the moment, we have not engaged into price controls. We have not started that process. Obviously, if it went haywire, then the government would discuss and see what measures to take. But at the moment, we are just appealing to the business community to exercise some reasonable behavior in terms of pricing of goods and services as well. Yes, Chimutai.
My name is Kagwe from TV. The last publication from the ministry was that any person that has traveled from an epicenter or a region that has reported a positive case, self-isolate. Definitely, this woman was in contact with somebody, and with this first reported case, and the World Health Organization declaring
Thank you. First and foremost, this is the time now we begin to understand what self-quarantine, is all about. Because first and foremost, I can confirm here that we are lucky, because this is a lady who was living. She's a young lady. She was living on her own, not with a family, but she has been in contact with people. And there was a question about whether we have traced them or not, and I can confirm that we have traced. Not even that. We have even traced the passengers who she was sitting next to. And trace here refers to a person sitting 2 rows behind you and 2 rows ahead of you. So those people, we know who they are, and we are also informing those in outside this country, because some of them are not in Kenya. But we have taken the responsibility of also informing those people. So in terms of self-quarantine, if you feel that you have got a cough and you have got the situation that we are talking about, this is where you withdraw. You don't want to affect your kids. You don't want to affect your family. This is where you withdraw and self-quarantine yourself. And all of you have been reading about even Hollywood stars who are self-quarantining themselves, prime ministers who are self-quarantining themselves. So this is a situation where, and I spoke about it, in reference to citizen responsibility. So if that is what you are feeling, you withdraw yourself from the room, you let somebody know. As I said, you can either if you are not that sick, you can find your way to a hospital so that we can test you. And if you if you think that there is further test necessary, we will isolate you. But the first thing for you to do, the first measure that you must make, if you feel that you are getting there, is to self-isolate. And there is nobody who can get a whole country and quarantine them. There's nobody who can take a whole village and quarantine it. So this is a measure that is being taken throughout the world. It's not a Kenya thing. I think
The
last one maybe.
The second last one.